Hi there, everyone out in Facebook land. It's Heather. I'm a registered midwife with Generations Midwifery Care in Brockville. And we've been doing Facebook Lives every Thursday. Thank you guys for tuning in. Today we are doing a very special Facebook Live for someone named Megan. So my cousin Mike and his partner Megan are pregnant, and she is now, I think, 40 weeks and 5 days. And of course, when you get anywhere near term, even 37, 38 weeks, you guys all know what Facebook starts doing. Facebook starts coming at you, and all your friends and family start saying, "Oh my gosh, when's the baby coming? What do you mean the baby's not here yet?" And so we are calling this segment, "Oh my God, Facebook says I'm past my due date." So let me just put this aside for a second here. So luckily for you, baby doesn't have internet access or a device inside your belly, and so has no idea that they're past their due date. And I was training and working just prior to the advent of all these social media things, and no one ever really got stressed out back then. There was a little bit of when's baby coming, but these days with social media, there's a lot of stressing out. You get anywhere near 39 weeks and people start wondering when baby's going to come. How do I get baby to come? Everyone's asking me when babies come. This isn't normal. Guys, it's totally normal. So here's about normal. Normal term is 37 to 42 weeks. And so that's a 5-week span. People will ask me all the time, do you have anyone due right now? Of course I have someone due right now. It's a 5-week span. There's like people from last month overlapping people from next month that are coming due, and all of that is normal. Um, yeah, we've got one person saying not even 37 weeks, and people have already been asking me when baby will be here. It's really good to say that you have a birth month instead of saying what your due date is. I've got a due month, and it might be somewhere in that month, or maybe in the early of the next month. Who knows? So there was a study done, or a bunch of studies done, based on when is normal for people to have their baby. And believe it or not, only 10% of people with their first baby have that baby by 39 weeks. 10%. So I'm really sorry, all you guys who are pregnant and hoping to go early. 10%. Then you have 50% of people will have their baby by 40 weeks and 5 days. So remember, I said that Megan was 40 and 5 today. Congratulations, you're on your physiological due date. You are not overdue yet. 75% of people will go by 41 and 2 days. So that's normal. That's average. Most first-time moms will go at least by 40 and 5, and it's totally normal to go 41 and 2, 41 and 3. That's all normal. So tips on how to get baby out. I've seen a lot of times people reach term and they say, how do I get this baby out? This baby is going to stay in there forever. We hear this a lot. Well, you can't. A lot of times people will go for brisk walks and eat the spicy ice cream and eating pineapple, spicy food. There's a lot of things that can encourage labor, but unless you were ready to go into labor already, it's probably not going to work. My advice to women is just to rest and sleep. Often all these techniques to get you into labor will just kind of make you crampy and miserable and not able to rest and sleep. And you might find that the more you relax and rest and just kind of let things be, the more they actually happen. So there are a few tips to getting baby out. One of the most well-researched ways to help encourage labor is called a stretch and sweep. So some of you might know a little bit about that. It's basically a vaginal exam. And what we're trying to do is annoy your cervix. So here's your pelvis. Your cervix is just an extension of the uterine muscle that comes down like the mouth of a balloon. And in the middle of pregnancy, it's long and firm and facing towards your bum and closed, and it's pretty high up. And so if I were to do a vaginal exam for that person, I'd usually have to reach around behind the baby's head in order to find it. As you start getting ready to go into labor, and as your body starts getting ready closer to term, it'll start to thin out, it'll start to dilate a little bit, it'll start to soften, and it'll move down, and it'll move closer to in the direction of your vagina. so nobody has to reach around your baby in order to find it. What a stretch and sweep does is we do a vaginal exam, we try to find your cervix, and if you can insert a finger and then maybe even two fingers, we can stretch that cervix, which releases prostaglandin. And even running your fingers along the membranes is called a sweep, so stretch and sweep. That releases more prostaglandin, and that helps to thin out and dilate your cervix. If it's going to work to put you into labor, it'll work within the next 24 hours. Research shows that repeated stretch and sweeps have been shown to reduce the number of women who have to be induced for going post-dates, but it's not a magic bullet. We still have to use that as induction sometimes. So it's the number needed to treat is 8. We have to stretch 8 women to prevent one from going post-dates. However, it's one of the more well-researched ways to encourage your body to go into labor. The other thing that you can do is if you were crampy from that stretch and sweep, you can use a breast pump. So babies sucking at the breast releases oxytocin, which is that same love hormone that causes contractions, which helps your uterus to contract, and that causes things to get moving. So if you use a breast pump, you can use it for 10 minutes on, 10 minutes off with an old movie for a couple of hours. If you get a really long and strong contraction that doesn't seem to want to go away, stop using the breast pump. It's one of the more natural ways to start inducing contractions. Again, it might just make you crampy and miserable. So remembering that the average person goes at least 40 and 5. If you start trying to prime your body to go into labor when it's not quite ready, it's normal to feel these crampy early things that don't actually put you into active labor, makes you unable to sleep, but it's not actually labor yet. Sometimes people find that really discouraging. It's okay. It's normal. Your body needs to practice before all of this stuff happens. Some people ask about other methods like castor oil to put yourself into labor. Castor oil tastes disgusting. It can be effective. There's some thought that kickstarting the smooth muscle that is next to your uterus, aka your bowels, can start your uterus contracting as well. And there have some people who've used that to good effect. There is a study that links using castor oil with a greater chance of having meconium baby poop inside the fluid, so having meconium stained water. There is a confounding factor to that, which is that people use castor oil when they're really overdue, and babies are more likely to poop in the water when they're really overdue. So that's one of the confounding factors with that. Usually if people take castor oil, they'll take 2 tablespoons with a cup of orange juice to help choke it down. Again, it might just make you crampy and poopy. So in efforts to make this a positive experience for you, Megan, I would say just wait for labor. There's other times when people have talked about in the natural birthing movement things like homeopathics or even black or blue cohosh. I don't recommend those things. There have been some studies that link some of those to various other side effects, which are not good. So it's funny, I always suggest just not messing with a system that's been proven to work. And again, most people go into labor on their own. So in the meantime, while you're waiting for labor, there's post-dates monitoring that you will probably have done. Again, my cousin-in-law, Megan, is with an OB, and so there are practices that all family docs and midwives and OBs do when someone goes over their due date in terms of monitoring. So most people ask, what is the dangers of going overdue and how far can I go overdue? And I've talked about that normal time being 37 to 42 weeks. So why does everyone get antsy after 40 weeks? And why do we start talking about induction? The Society of Obstetricians and Gynecologists of Canada recommends inducing between 41 and 42 weeks. And that's because as a pregnancy gets older, the placenta can start to get a little bit older and stop working so well. So the stillbirth rate starts to go up. However, it goes up in tiny, minuscule amounts. So at around 37 to 38 weeks, it's about 0.2 in 1,000. And about 40 or 41 weeks, it's about 0.3 or 0.4 in 1,000. At 42 weeks, it goes up up to about 1 in 1,000. So when people, sometimes people have care providers that say it's way more dangerous. Yeah, you could say it doubles. You could say it triples, but we're still talking about the difference between 0.6, 0.4, and 1 in 1,000 babies. Part of the reason why we recommend monitoring is because of that increase. So we can't tell by looking at you which person that's going to be. So we recommend doing something called a biophysical profile. A biophysical profile is an ultrasound that checks on 4 things. It checks on the baby's movement, so whether they're kicking around. It checks on their tone, whether they're all crunched up in a nice little ball. It checks on fetal breathing movements. So in the uterus, they practice breathing the amniotic fluid in and out, and on the ultrasound you can see their little diaphragms going up and down. And it checks on the amount of amniotic fluid. The only thing that really matters in that biophysical profile is the amount of amniotic fluid. And in fact, there's been a movement to change from doing a BPP to a non-stress test where we put you on the monitor for 20 minutes and check how many rises in the baby's heart rate we get, plus doing an amniotic fluid index by ultrasound. But depending on the area, you might have that or you might have a BPP. The reason that the others don't matter as much is that babies will stop moving if they're sleeping, and they will stop practicing fetal breathing movements for between a half hour and 2 hours, especially if they happen to be sleeping. So if you happen to catch them at a time when they're just not rocking and rolling, you might get marks off on your BPP. So if you have an amniotic fluid index that is lower, that's a reason to induce, but the other ones we tend to do some more monitoring and just make sure baby's okay. The research says that if you do that kind of monitoring once every 3 days, then that's a really good form of making sure that baby's waving back at us and making sure that you're okay to keep waiting if you want to. But if you want to be induced at 41 weeks, sometimes people say, I was done at 37 weeks. And other people say, no, I'm good to wait. If you want to be induced then that's great. If you want to ask your care provider if you can wait a few more days, then the evidence says that's okay too, up to about 42 weeks. Now in midwifery care, we do offer the choice of, hey, sometimes people say, all my mom, my grandma, everyone went at 43 weeks. Sometimes people want to keep waiting. As long as all of that monitoring is okay, then as a midwifery client, that's up to you. But we just make sure that we're really keeping a close eye on baby. And then, you might wonder what induction is like. So your care provider might talk to you about setting a due date for induction. And if you haven't got into labor by such and such a date, then they'll induce. Usually that means getting your cervix ready, making sure that it is starting to dilate, and then starting oxytocin, which is that hormone we were talking about, through an IV. You would have external fetal monitoring with that situation. Whereas if you go into labor on your own, the recommendation is to listen to the baby every 15 minutes with a Doppler, like that one. So early labor, say you were successful and you managed to get some rest and you tried the breast pump and maybe you ate the spicy ice cream and it worked. And you might be wondering what early labor is like. Early labor can start with signs like losing your mucus plug. So your mucus plug can come out and it looks like you just blew your nose into the toilet. It can have some blood in it. It can be different colors. It can be yellowish or greenish. Some people never notice losing their mucus plug. Some people say it just like this mucusy, snotty stuff keeps coming out of me. It doesn't mean you're going to go into labor. It doesn't mean you're going to go into labor like tonight or tomorrow. It could be 2 weeks. It's no reason to page your healthcare provider, and it's no reason to go on Facebook and tell everybody what's going on, because it's just your body getting ready. It's your cervix softening, which is a good sign. And then you'll start getting contractions that are really mild and crampy, but not really timeable, just sort of mild. We call it an irritable uterus. And that usually turns into something a little more regular and a little more consistent. And I was asking about the spicy ice cream is that I keep talking about. There's this place in Ottawa that claims to have, I think it's in the market. Megan actually went and tried it. I saw it on Facebook. There's this place in Ottawa that claims to have an ice cream that'll put you into labor. Okay, you guys know I'm the skeptic midwife, right? I don't believe it. but I believe that ice cream is yummy. So go ahead and eat your ice cream. What was I saying? Oh yeah, so the early labor contractions, ignore them. Um, People often really get excited with early labor contractions and they start timing them and they're like, okay, great, they're every 12 minutes, lasting 20 seconds. And I remember once very early in my career going to assess someone and they had whiteboards set up all over the place. They had at least 6 of them. And all these timings were set up with all the early labor contractions and how it had gone from every 20 minutes down now to every 4. And it was for the last day and a half. And I walked in there and I thought, wow, you guys, like, you're just starting labor and you must be really tired, so that early labor stuff, just sleep through it. Or distract yourself, go out to a movie, go out to dinner. It might be your last chance for a while to get some alone time. Sometimes people will go for a brisk walk around the block hoping to make that early labor into active labor. Again, it'll just make you crampy and miserable and not sleeping. So it's a big difference if you go into active labor well rested, well slept, versus up for a couple of days monitoring this early niggly stuff, and being exhausted. You want to go into labor well slept. So when you have those early contractions they feel like menstrual cramps, you might feel them in your back, they might move around to the front, they might even take your breath away. You might have to breathe through them. You might even have to sort of lean over and breathe through them. Still early. If you can possibly take a Tylenol and a Gravol, have a warm bath, go to bed, sleep, sleep, sleep. And when you can't sleep anymore, rest and distract yourself. When they start getting strong enough to be every 4 minutes, lasting a minute, and they've been that way for an hour, that's when you page your midwife or choose to head to the hospital if that's what you're doing, if you don't have a midwife to come to your house. With midwifery care, we will often go to people's house to assess them regardless of where they choose to birth. And then if they choose hospital, then we will labor at the house for a while and then move into the hospital when they're good and active. Because Megan's with an OB, she would go to the hospital, be assessed there. And this is why I say don't go too early, if you are like 1 centimeter dilated and not really in active labor, if they're a good hospital, they will send you home. Because the guidelines are to try and keep everything as normal as possible and not admit people who aren't in active labor. So the idea is not to make many trips to the hospital and back to be checked and then be sent home and then checked and sent home. And usually when you are having the contractions that are 4-1-1, every 4 minutes, lasting a minute, they've been that way for an hour, from the start of the one to the start of the next, usually you're about 3 or 4 centimeters dilated. All of that goes out the window for your second baby, because usually what I tell people with their second or third or fourth or whatever baby is, when you know it's it, call me. And I saw someone say hi, who I have attended a few births with, who also knows that truth of when you know it's it, call me. Right, BJM? Anyway, so things to bring to the hospital. Again, this is for anyone who's just joined in. This is for my cousin Mike. His partner is pregnant and is now 40 weeks pregnant and 5 days. They have an OB in Ottawa, and so I'm doing a little Facebook Live for them in terms of what to prepare and sending good labor vibes. What to bring to the hospital. Hospital pillows really suck. So they usually are plastic flat pancakes. So bring your own pillow in a brightly colored pillowcase. Bring lip balm, because when you breathe heavy through contractions, your lips tend to get really dry. The hospitals in Ottawa have more food options than the hospital in Brockville, but they're still not really awesome. So bring light foods that you would want to eat afterward. Sometimes people find it really helpful to bring their own blanket. Bring flip-flops, because hospital floors are disgusting. So bring flip-flops that you'd want to wear. Some people like wearing the hospital gown that they provide. Other people want to wear like an old sleep shirt. That's fine. You don't have to wear the hospital accoutrement. You can wear your own stuff. And anything that you would find soothing. Some people like music. Some people like to have certain scents. Some people like to have a certain bathrobe that they find really comforting. So anything that you would sort of have that that would soothe you when you're sick, bring that kind of stuff. The other things that are helpful are your own shampoo and conditioner, because they usually don't have that stuff at the hospital, and things that you would like to drink. Anyone have any questions from Facebook land so far? Not yet? All right. And what to expect at the hospital. When you get to the hospital, it's really helpful if you're planning a hospital birth to go and do a tour beforehand and to know the setting that you're going to. So if you have a midwife, you will have that midwife come to your home, and if you're choosing a home birth, then we'll just labor there and have a baby. We call another midwife when it's time for baby to be born. If you're choosing to deliver at the hospital and you have a midwife, then we labored there at home for a while. We move into the hospital. You have your primary midwife with you for the whole thing. We get you admitted, get you comfy in the tub or in the shower or on a birth ball in order to make you more comfortable. And the care provider part of it is very known. If you have an OB, you generally have a team of OBs, maybe 3 or 5 or 7 OBs, and then you would meet that OB at the hospital and your nursing team. So you would have a nurse assigned to you. And if you have a specific birth plan, it's helpful to have that printed out beforehand. If you're with a care provider that you don't know. If you already have a care provider that you do know, then it's great. They know you, you know them. You've gotten to know each other over the course of your pregnancy, and they can help facilitate what it is that you want in your labor. If you don't, it's helpful to have that written down for them to just the basics, for them to get to know you a little bit better. Generally speaking, you'll get admitted. They should, in a normal low risk pregnancy, they should be listening to your baby every 15 minutes with a Doppler. And this is where being familiar already with the setting is really helpful, because the role of fear in childbirth in our culture is a big one. So this is the same thing, back to Facebook says I'm overdue, even down to being before the due date. People get really scared of what happens if I'm not normal. Facebook says this isn't normal. Labor is a really intense process, and if you are afraid, then that accentuates and makes the whole thing more painful. There's a huge role of fear and pain control. So being familiar with that setting, being familiar with where you're going to go, meeting some of the nurses beforehand, that's really handy. And ideally you have someone there who can remind you, hey, this is normal, you're doing really great. And that'll make the whole thing go really smoothly for you. I've got somebody saying, laboring in the shower with you sitting on the floor of the bathroom with me honestly made it go by so much better. Yeah, I remember that. It's often when people are laboring, we will sort of get a sense for what it is that they need in labor. So some people need me right there, being with them, coaching through every contraction, and other people need me sitting on the floor, charting and making small talk and telling jokes, and other people are just so much in their zone that I don't want to interrupt them, and I'm sitting, in the next room, just watching them and monitoring how things are going. So whether that's home or hospital, that's all the same. We monitor everything the same, across professions: home, hospital, OB, midwife, family doctor. Everything's monitored the same for babies following the SOGC guidelines. So hope that helped, Megan. You're normal at 40 and 5, you're normal at 41 and 3, you're normal at 41 and 6. Good luck with your labor, and you guys can always call me if you have any questions. Thanks. Bye.